A 28-year-old man presents to the office with complaints of malaise, anorexia, and vomiting for the past 2 weeks. He also notes that his urine is dark. The past history is unremarkable. His temperature is 36.8, pulse is 72, blood pressure is 118 by 63, and respiration rate is 15 per minute. Physical examination reveals a slightly enlarged tender liver. No edema or spider angiomata are noted. Laboratory testing showed the following: HBsAg positive for IgM. Okay, anti-HBC is less than 1:1000, and anti-HBs is negative. HBeAg is positive. HBeAg antibody is positive. HBV DNA is 2.65 into 10 to the power 9 units per liter, and alpha fetoprotein is 125. Which of the following is the most likely cause of the patient's condition?
So basically now I'll talk directly about, suppose we have an acute case of hepatitis B. Acute hepatitis B virus case. Okay. So in acute, I am using the table which is mentioned in first aid. I am not using anything extra. So do not worry about it. In case you do not understand it, just make sure you go back and read your first aid page after this. Okay, it's given on one page only, so you can just go and read one page off. Okay. So basically, when you're talking about an acute infection, so which antibody will be there, IgM or IgG? So we have IgM. Your IgM antibodies will be there. So your anti-HBC, which is basically anti-HBC, is the antibody to your core of the hepatitis virus. Okay, so it is the outer body, it is the inner core. All right. So in acute hepatitis B, the person will be HBsAg positive, like it's written over here. You can see HBsAg positive IgM, which means acute case. All right. So, and it will be HBeAg positive. So HBe basically talks about the envelope of hepatitis B virus. All right. Basically, what does HBeAg positive mean? HBeAg means that the virus is replicating at a very fast rate and it is still active and the person can still spread the infection. Okay. Yeah, envelope antigen. All right. That is very good. But you have to remember, what does HBeAg in a question talk about? Okay. Positive HBeAg means that the virus is still replicating very fast and the person can still spread the virus. Okay. And anti-HBe is negative in HB in your acute infection, which is in this case, like in an acute HBV infection, anti-HBe, which is your antibody to HBeAg, is negative. So basically that means to tell HBeAg, when it is positive, it means high infectivity, and when anti-HBe is positive, that means low infectivity. All right. So basically, when you have an acute case of HBV, it will be HBsAg positive. You can always refer to your first aid tables. That is not a problem. But yeah, HBsAg positive. Then it will be HBeAg positive. Okay. And antibody, like you people have mentioned, since it's an acute infection, so it will be IgM. All right. So this is what is there in your acute phase. Okay, now we come to the next part. According to your first aid, as it's mentioned, it is the window phase. Okay, window phase is the point of immunoclearance. All right, when you will have just anti-HBe present and anti-HBc IgM, which is just a marker. So don't worry about it. Basically, in your window phase, remember, HBsAg won't be positive, HBeAg won't be positive. Why? Because in your window phase, think of it like your body is low on the virus. It is just trying to clear the virus. This is the phase where you don't really have any infection. So HBsAg, which signifies positive, yes, no replication. All right, that's it. Good. So HBsAg is negative in a window phase and HBeAg is also negative in a window phase. All right. So next part, which we go according to your first aid. Now we talk about chronic. Okay, chronic can be of two types. It can be high and low transmissibility. Usually you won't be troubled with this in your question, but yeah, sometimes it can be there. So it is very important to know what is high and low transmissibility. So what will be the HBs? I'll ask you people. Okay, let's see how much you have understood. So when you have chronic hepatitis B, either it is your high infectivity or low infectivity, what will be HbsAg, positive or negative? Just write plus or minus in the question. Okay, yes, it will be positive, it will not be negative. Why? Because the body is still having your, I'm talking about HbsAg, not E, S. HbsAg will be positive, so I will write here S positive. So anytime HbsAg is positive, that means your body is still holding that infection inside. Okay, and what E tells you is, E basically tells you the transmissibility. So now you tell me, in a high transmissibility chronic hepatitis B virus, what will be E? This is very direct, like I've given you the answer already. Yes, positive. Okay, and in low transmissibility, it will be negative. All right. So now we'll come to the other two categories, and I'm going in the order of first aid so that it is easier for you to read also. Okay, nothing fancy. So now we talk about recovery phase. Yeah, now recovery phase, you tell me the person has recovered from hepatitis B. So what will be HbsAg in this? Plus or minus? Yes, HbsAg will be negative. So antibodies to HbsAg will be positive, right? Does it make sense? Because a person has recovered from an infection and now the body has developed antibodies to fight off that infection. So now in a recovery case, you will have anti-HbS positive. All right, plus anti-SHB positive. Yeah, IgG only, because it's already recovery. Recovery means it has passed through your chronic phase. Acute, whenever the word acute is used, remember IgM. Whatever it is, IgM. Whenever it is chronic or recovery or immunize is used, remember IgG. Either it is acute IgM or anything else is IgG. Okay. So talking about recovery, like you people told me, HbsAg will be negative, but the body has fought the infection and now HbS will be positive. Now you tell me about HbEAg and anti-HbE, which will be positive. Just tell me which will be positive. Anti-HbE. All right. So you remember this in a crude language. I am trying to make this table easy for you. Anti-HbE will be positive because the body has literally fought over the replicating virus also, and basically now the virus is also not replicating and antibodies are there against it. Okay, so done and dusted. The virus is gone. Now we'll come to the last case, which is an immunized patient. So in an immunized patient, anyone would like to tell me what will be positive and save a minute for me? Otherwise, I'll only directly tell. So anti-HbS will be positive. All right. So what about anti-HbE? Because the body never had an infection. All right. That is how I remembered it. Okay. So basically, when you were immunized, the body never went through the pain of viral multiplication and all that stuff. You were just poked with a vaccine, and that's all. So that is why you have anti-HbS. Yes, very good. And so the body was not exposed to it. So there was no multiplication of virus. So there is no antibody against it. Okay. Now we'll come to the question. Okay. We'll just go with this part. So it is HbsAg positive. IgM. That means it's an acute infection. All right. So this says anti-HBC is less than 1:1000. That means consider it as negligible. All right. So now anti-HbS is negative. Anti-HbS negative means that means the person is not in recovery phase. The person is not immunized. All right. Now HbEAg is positive. That means there's an actual infection going on right now. All right, and the person is uh, a spreader right now, like has high infectivity. All right. Now, for some reason, this says HbEAg antibody positive, which, all right, I have not been able to find out why exactly are they trying to tell both positive, but maybe they are just telling you that this is a chronic infection. Okay. So chronic infection will have your antibodies to HbEAg positive. All right. So I'm not talking about high or low transmissibility. I'm just talking about a chronic infection. So think of it like this: you have a chronic infection. So in chronic infection, if they have written HbEAg positive, that's all right. They're basically telling high high infectivity is there. All right, but now they are writing anti-HbEAg is positive. That is mean the body is in chronic phase. it has formed antibodies against HBeAg virus, against a hepatitis B virus, against the HBe. All right, against the envelope. All right. So now we'll come to the diagnosis. Basically, they're talking about a chronic case, and they're telling about acute also. So basically, I feel this is acute on chronic. Acute on chronic exacerbation. So coming to this, we come to this option B. All right.
Thanks for watching. Please give a thumbs up and subscribe for more.